Hello, welcome to another session. We are looking at embryology of the GIT. My name is Dr. Eric Edu of the Department of Anatomy and Cell Biology of the School of Medical Sciences, University of Cape Coast. We want to begin with Odontogenesis, which describes the formation or development of the teeth. The teeth is one of the most ignored structures when it comes to digestion. We hardly think of it as playing any major role. And as such, we use it for other purposes like biting of hard structures. We bite our fingernails. We are able to do all sorts of things with the teeth. There's a funny story that says that somebody used the teeth to open a tin of milk. I wonder how that is possible, but you can imagine the kind of things people use their teeth for. Beyond that, we sometimes don't take good care of it. You are supposed to brush our teeth twice a day, morning and evening. Ask yourself, how many of you go by that? So the teeth is very, very important, and let's take good care of it. Now, the teeth, as hard as it looks or is, develops from a very soft part of the trilaminar disc, okay, which is ectoderm, all right? This is the ectoderm in blue. The conventional color for ectoderm for embryology is blue. Then you have the mesenchyme deep to the blue. Now, as you can see, the inferior portion of the midline of this blue is invaginating or growing downwards. Okay, so that's a downward growth. We call that downward growth the dental lamina. Okay, and the presence of the dental lamina is the first indication of tooth development. Now, for descriptive purposes, the stages of development of the tooth can be grouped into three. We have the bud stage, the cap stage, and the bell stage. Right. So after the dental lamina is formed, the next is the bud stage. So we have the tooth bud, okay, forming. And by the 6th week, this dental lamina would have formed and progressed to form the dental bud, okay, which is the tooth bud here. Then as the development progresses, you are going to have an indentation of the inferior portion of the tooth bud, giving it an impression of a cap. Okay, it's like an inverted cap, an upside down cap. Okay, so you can hold the portion labeled the dental lamina as if it's the stalk of the cap, and then you can pour your items into the cap if it is turned upside down, right? So that's why it is called the cap stage. Then as it continues, you have neural crest cells infiltrating the invaginated inferior portion, okay, which will eventually form the dental papilla and then dental follicles. Now, as you can see, the cap stage has become impregnated with a substance in the middle portion, and therefore you are having two layers, okay? One is an inner layer, and then the other is the outer layer. As you can see, at point C, you don't have that. So at this point, you have an inner enamel epithelium, and then what? An outer enamel epithelium. It's just like having a parietal epithelium and what? A visceral epithelium. Just like you have in the development of the lungs, okay? And then also of the heart. Then if you're looking very closely, you realize that there is a diverticulum which has been labeled bud of permanent teeth, okay? What does that signify? It means that there are two sets of teeth. You have the deciduous teeth and then the permanent teeth. So the deciduous teeth is the one that appears first, and then it gets erupted and then replaced by the permanent teeth. All right. So when the deciduous teeth appear later in life, they will be replaced by the permanent teeth. And therefore, this bud of permanent tooth, as you see here, is lying in wait, okay, to form a permanent tooth after the eruption of this deciduous tooth. All right. So we say that the tooth bud for the permanent tooth with a predecessor of a deciduous tooth appears and grows lingual, okay, towards the tongue, all right, in that fashion. I'm saying this because you come to see that there's another kind of bud for a second set of a permanent tooth that do not have a predecessor deciduous teeth, okay? So let's take it gradually. It will soon make sense as we move on. So we have established that the cap stage is now having an inner enamel epithelium and then an outer enamel epithelium, okay? And then you have infiltration of neural crest cells or mesenchyme in the inferior portion, which was invaginated, that is now forming the dental papilla, okay? Good. Then as growth continues, the cap stage or shape now assumes a bell shape, as you can see here. So now you have an apex, which is like a pyramid, okay? So this is like a bell, okay? A bell that is rank. Now, we have other components of the teeth developing, okay? And you have what we call odontoblasts, which are coming from mesenchyme. And here, when we say mesenchyme, we're actually talking about neural crest cells, okay, which migrate to that point, and they produce dentine, okay? Then you also have amelloblasts, which are actually arising from the inner enamel epithelium, okay? And they produce the enamel, right? So that is the odontoblastic layer. And then you also have the enamel there. So that is also enamel in yellow, okay, deep yellow. You also have what we call the periodontal ligament, this one, which also comes from neural crest cells. So mind you, neural crest cells are ubiquitous and they migrate and form a lot of structures in the body. You also have the cementoblasts, which will produce the cementum or cement, okay? Right. So basically, this is how it plays out. Let me now explain how the deciduous teeth are replaced by the permanent teeth. So you are going to have 10 of the tooth buds that will form the deciduous teeth in each jaw, 10 of them. So 10 in the lower jaw, 10 in the upper jaw. And this 10, if you even take just the lower jaw, the 10 is formed in a fashion where you have 5 on one side and 5 on the other side. So let's try and list the members of these 5. So the 5 on one side will be made up of a medial incisor, a lateral incisor, and then one canine, followed by the first premolar, and then what? Second premolar. So when you add all, you are going to get 5. Let me go over again. Medial incisor, that is 1. Lateral incisor, 2. 1 canine, making 3. And then you have 2 premolars. That is the first premolar, second premolar, making 5. Okay? However, in the adult, you are supposed to have 16 in the lower jaw, 16 in the upper jaw, making 32. Okay, but as we have described in the lower jaw, we've now had just 5 on one side, making 10 maximum. So we need an additional what, 6. And that 6 will be divided into 3. So 3 on one side, adding up to the 5 to make 8, and then another 3 on one side of the same jaw. Okay, so we're going to have 8 on each side, making 16. Okay, so those 10 tooth buds that form the deciduous teeth will be made up of the medial and lateral incisors, the canines, and then the first 2 premolars. All right. Now, what happens is that the permanent tooth, which will not have any predecessor deciduous teeth, will now cater for the other 6 that we are left with. All right. So those are the molars. So you have the first molar, second molar, and third molar. Okay, so there are 3. So 3 on each side of the jaw, making 6, adding to the 10, making what, 16. So it is these 3 molars that do not have a predecessor deciduous tooth. So the first molar will appear within the fetal stage. Okay, and then the second and third usually occur after birth. All right. However, the other permanent teeth, that is the premolar, appears in the 10th week. Okay, so the first and second premolars will appear in the 10th week. And they are the ones that have this bud of permanent tooth appearing on the side of the cap stage, okay, of the developing tooth. All right. So for the other permanent tooth, that is the molars, they have their tooth bud developing from the dental lamina through a posterior extension. Okay, unlike that of the bud of the permanent tooth that grows lingual towards the tongue, that of the molars will grow by posterior extension from the dental lamina. So get that clear. Good. So we have dental situations in a natal stage, a neonatal stage, and then an adult stage. Some babies are born with teeth in their mouth already erupted. Okay, these are the true babies with sharp teeth, not the ones in the political arena. They are born with teeth already in their mouth, and usually these are incisors at the lower jaw. Okay, and such a baby, you have to be careful if you are breastfeeding that, because it can show you a little pepper through biting. So you have to be careful with that, but it can easily be removed. Okay, sometimes not even biting the nipples of the mother, but they can accidentally bite their own tongue, okay, and cause some lacerations. So at birth, we call that natal teeth. Then you also have some of the teeth that erupt by the 4th week and then ongoing counting. Okay, those become the neonatal teeth. Then obviously for the adult teeth, we have the whole armor. Okay, so you can count 1, 2, 3, 4, 5, 6, 7, 8 on one half, and then 8 on the other half. So these are the 2 incisors. Okay, so this incisor is the medial one, and that is lateral. Okay, so medial incisor, lateral incisor, and then this is one canine. Okay, then you have the first premolar, second premolar, then you now have the first, second, and third molars. All right, and the teeth are located in the jaw. Okay, so it will be interesting to see how the jaws are formed and then the palate are also formed. This is a table that describes the type of tooth, its eruption time, and then shedding time. Okay, this was taken from Kate Moore. you can use that to guide you to know exactly what happens to each type of tooth. So you have deciduous here, permanent here, and then the timings are shown or arranged here. Okay, so this is the upper jaw. So you can see that this is the roof of the mouth, that's the palate, hard palate. Okay, this is the lower jaw. So if the tongue was situated, you will find it lying in this space. So we are going to talk about how the palate is formed. The palate forms from 4 prominences, okay, 2 pairs each. So one of it is the maxillary prominence, and then the other is another prominence, which is medial to the nasal placode. It is known as the medial nasal prominence. Okay. Now, it is instructive to note that these incisors, the 4 of them, are located within where the medial nasal prominence fuse. Okay. We call it the intermaxillary segment. You'll see that shortly. But these very portions, okay, are going to come from the maxillary prominence, the pair of them that will fuse. So when they fuse, that's the midline. Okay. So using this diagram, you have lateral nasal prominence. Okay. And therefore, you also have a medial nasal prominence. Then you also have the frontal nasal prominence. When you look at this portion, you realize that the 2 medial nasal prominences are fusing. Okay, so there's a fusion here. Eventually, this is what is formed. As the fusion is ongoing, you can also see that flanked on each side is the maxillary prominence. Okay, so eventually the maxillary prominence will also come together and then fuse, as we saw in the adult palate. So at this point where the medial nasal prominences are fused, okay, or merged, it is now called the intermaxillary segment. Okay, and this will help form the part of the jaw where the incisors, as I said earlier on, are situated. And again, you have also the phaeton of the lip also situating there. Okay, so that is how the palate is formed. All right. Now, having talked about the development of the palate, we want to look at the development of the tongue as well. Now, the tongue is formed from contributions given by the pharyngeal arches. Okay, so pharyngeal arches, as far as embryology is concerned, is so important. You always have to revise and know that it should be at your fingertips. So there are 4 of the pharyngeal arches. Okay, so we have pharyngeal arch 1, 2, 3, and 4. The tongue is formed from about 3 of these, 1, 2, and 3 arches. And it starts by the formation of a medial swelling known as the tuberculum impar. Tuberculum impar. So you have the medial swelling there in blue. Okay, the same, you find it at the top there. And you also have 2 lateral lingual swelling. So this is one, that is the other one. So these are the 2 lateral lingual swelling, and then the medial swelling, which is also known as the tuberculum impar. The tuberculum impar appears first, and it is the first indication of the development of the tongue. As time goes on, even though, as they say, Paul Ambantem or since these 2 lateral lingual swellings, which do not appear early as that of the tuberculum impar, end up at raising the tuberculum impar, i.e., they overgrow it, okay, and then subdue it. So these 3 are coming from arch 1. Okay, lateral lingual swelling, medial lingual swelling. And the two lateral lingual swellings that outgrow the medial ones merge. When they merge, they form the anterior two-thirds of the tongue. Okay, anterior two-thirds of the tongue. The median sulcus of the tongue will indicate the line of fusion of these two lateral swelling. Okay, so there's a midline groove there. So this blue portion will form the anterior two-third or the oral part of the tongue, which is formed by the two lateral lingual swelling and the one medial lingual swelling. However, the two lateral ones outgrow the medial one. Okay. So we are now left with the pharyngeal part of the tongue or the posterior one-third. Now, as I discuss this, what should be running through your mind is the innervation, having in mind the pharyngeal arches and then their nerves. Every pharyngeal arch has its own peculiar nerve, which it doesn't share with anyone. So it supplies the structures that are formed from that particular arch. So we know that arch 1 has the trigeminal nerve, okay, cranial nerve 5, which has both sensory and motor. So the general sensation of the anterior two-thirds, okay, because it is coming from arch 1, will be innervated by the trigeminal nerve. That is the general sensation. Okay, general sensation. As we move on, you come to realize that there's a contribution from the second arch. So the posterior one-third forms from the cupula and then hypobranchial eminence. Okay, so the cupula is arch 2, and then the hypobranchial eminence is arch 3. All right. The hypobranchial eminence outgrows the cupula, okay, and therefore covers it. And then there are also migration, okay, and movement of some of these arch components into the anterior portions. All right. So there are some outgrowths and then also some movement. So that is a hypobranchial eminence or hypopharyngeal eminence. So you can see migration of third arch, okay, mesoderm. Migration of third arch. So just like I said, there are some migrations that go on, and the arrow is indicating that. All right. This is the ramal glottis. So the point at which the anterior two-thirds, okay, merge with the posterior one-third is indicated by this terminal sulcus or sulcus terminalis. You also have the foramen cecum. The foramen cecum is a point of attachment of the thyroid gland. So it descends or migrates, okay, from the tongue. So that point is an indicator of where the thyroid gland was. So you have what we call the thyroglossal duct. Okay, when we start looking at the development of those glands and structures, we will talk more about that. So this is just a summary of what we have talked about so far. So these are the two lateral lingual swelling, and that is the medial one, okay? And you can see that the two lateral ones are fusing and then have overgrown that of the third one. Initially, the third one looks even bigger. That's the medial one looks bigger than the two lateral ones, but then you can see that, and then eventually it outgrows that. Okay. Then we will end this first part of the lecture with the development of the salivary glands. One of the major salivary glands is the parotid gland. It's the largest and the first to develop. Okay. And in histology, we say that it is purely serous. This appears in the early 6th week. and its origin or source is from the oral ectoderm, okay, which buds close to the future mouth known as a stomodium. So there's budding of the oral ectoderm, okay? And once this budding occurs, you have a solid cord, okay, of the bud, which will later canalize and therefore form a lumen within it. And this lumen is now going to act as the duct, okay, of the gland. However, the rounded portion where there was no canalization becomes the secretory acyna, okay, what I call the manufacturing center. So usually the cells there are cuboidal and they will secrete the saliva, and the saliva will pass through the duct to its destination. So what are you taking home from this slide? That all the secretory tissue developed from oral ectoderm, okay? And the secretory tissue is also known as the parenchyma of that gland, okay? The resident cells or tissues that perform the function of the structure we are talking about, that's the parenchymatous tissue. All connective tissues will form from mesenchyme. And again, when I say mesenchyme at this point, we are talking of neural crest cells. Okay, so the connective tissue come from there. The secretions commence around the 18th week after fertilization, which means that saliva will start its activity by 18th week after fertilization. Then also we talk about the second type of salivary gland, that's the submandibular gland. It is the second to form, and this forms late in the 6th week, unlike the parotid, which is the early 6th week. This is late 6th week. And the source is endodermal, unlike oral ectoderm. So this is ectodermal, and this is endodermal. It also buds just like that of the parotid gland, okay? This buds from the floor of the stomodium. The secretion commences at 16 weeks after fertilization. And then the growth continues after birth, all right? Then the last one is the sublingual gland, which is the last to form around the 8th week, approximately 2 weeks after that of the submandibular and even the parotid. The source and process also endodermal, just like that of the submandibular gland. It also buds, becomes solid, and then later it is canalized. Okay, so this is just the basic steps to follow for the development of the salivary glands. And you appreciate that when we are looking at the histology of it, the situation of the first come, first served basis also contributes to what kind of secretion the gland is having. Okay, so you have serous purely, and then you have seromucous, mixture of serous and mucus, but more serous for submandibular, and then for sublingual, it's also seromucous, but then you have more mucus. So in that order, and that is how their development also. Okay, thank you very much. You will have a part 2 of the lecture on the gastrointestinal tract. Thank you, and I hope this helps. See you some other time.